Hi, I'm Dr. Gary Hoffman. I'm a colon and rectal specialist at Cedars-Sinai Medical Center and with Los Angeles Colon and Rectal Surgical Associates. Today's Answer the Mail Day, and I received an unusual email from some young people. Jessica, Jordan, and Farrah wrote in, and they want to know what happens if they've tried everything for hemorrhoids and nothing helps. I'm here to answer that. Hemorrhoids are nothing more than arteries, nerves, veins, and some connective tissue covered by a lining. And as they get enlarged, these veins get engorged, almost like varicose veins in people's legs. And they can prolapse, they can fall out, they can itch, they can cause all kinds of symptoms. And there are all kinds of treatments that we can use to stop the symptoms. Hence the question, what if all of that fails? If all of that fails, there's the old way and there's the new way. Both are surgery, both are operations, but with very different post-operative courses. So I guess the easiest thing is to answer the question, what's the old way? The old way is this. That's a knife blade. In the old days, the way we used to do it was with patients asleep and patients unaware of anything, we would go in and use the knife and simply remove the hemorrhoids by cutting them out. That's the old way. What's the new way? Well, there are many new ways. One of them is THD. That's a certain type of hemorrhoid procedure, which is associated with a lot less pain. And another is PPH. This particular procedure is called PPH because it stands for Procedure for Prolapsing Hemorrhoids. That with patients asleep, the instrument is put inside and way above the level where there are any pain fibers, the hemorrhoids are removed almost like a cookie cutter by putting it in, turning it, and pulling out the hemorrhoids, and they are automatically stapled back together. And I'm telling you that while you're asleep, you won't feel anything, and the pain afterwards is much, much less. This has been proven. What the PPH does is, by simply using a cookie cutter technique, removes the hemorrhoids, and that should be the end of the problem. Of course, a visit to your colon and rectal specialist will give you all the answers to your questions, and you should have many. But the bottom line is that PPH is much, much less painful than a traditional hemorrhoidectomy, and we have performed many, many of these in our practices. Doctors Faruzman Kepianu and myself do these all the time in Los Angeles at Cedars-Sinai, and they're very successful, very good cure rate, and patients are back on their feet and going very quickly. So we have the old way and the new way, and most people vote for the new way. Farrah, Jordan, Jessica, I hope this answers your question. Keep on writing.